but the last TIA before we came to Thailand. And it wouldn't matter what country we were living in, whether it was Turkey, we used to live in Bali, we came here, United States, we come here. So yeah, we come here because we like Thailand and their medicine is the best. We've been coming to Thailand for many years. We love Thailand. We know their medicine is good. That's why we choose to come here, for their medicine and the people and just the experience. So yeah, that's why we came. TIAs for many years. What do we do? But if you go to a doctor, they just give you pills and it doesn't help. So we just took care of ourselves. But the last TIA before we came to Thailand, he had no cognition. And that was a dangerous, and his blood pressure was really high and we couldn't bring it down. That's when we decided we need to come back to Thailand.
We went to one private cardiologist and he gave us some pills. And we decided, well, that isn't going to do. So that's what we really thought it would be the best thing to do, is to come here.
A Turkish cardiologist suggested we go somewhere else for this. The cardiologist we went to was, compared to here, so we came here. My grandson broke his shoulder badly in Japan, and he came to this hospital, and my daughter said, "Mom, you'll never get a better hospital than this one. Come to this hospital." So
they were here just a month before we came with his shoulder. So we came here.
This 85-year-old gentleman came to Bangkok Heart Hospital with repeated episodes of blurry vision, slurred speech, and mild memory problems that have become more frequent over the past year. Each episode lasts 5 to 10 minutes and then resolves on its own. These symptoms suggested a warning sign that we call a transient ischemic attack, or TIA. Yes, he had high blood pressure and high cholesterol, both of which increase the risk of stroke. He had also been diagnosed with TIA about 9 to 10 years ago and had received treatment both in his home country and in Thailand. In addition, we discovered he had narrowing of the right coronary artery and paroxysmal atrial fibrillation. We performed a carotid Doppler ultrasound and MRI, which showed a 60 to 70% narrowing of his right internal carotid artery. This was the cause of his TIA. The condition was serious and we need to act to prevent a permanent stroke. We performed a right carotid endarterectomy. This is a surgery to remove the plaque blocking the artery. To prevent it from narrowing again, we also use a small vein patch from his leg to widen and reinforce the artery. This surgery greatly reduces the risk of future stroke, especially in patients who already have symptoms. It improves blood flow to the brain and may help stabilize memory and thinking. Compared to stenting, carotid endarterectomy has a lower risk of stroke after procedure.
What's interesting, because the surgery happened and I was out for that. So I woke up in the ICU and I didn't know anything had happened. Not a lot of pain. I was lying in a hospital bed with a lot of nurses, and the doctor would come in occasionally and say, "How are you?" And I would say, "Fine." And I had these things all over me, checking me out. And I was there for 4 days. But basically, I felt I was just sort of wanting to get up and go do my day rather than being in the hospital. But they said, "No, you really need to be here." And I'm sure now, looking back, it was good that I was there. Once I left the hospital, I was pretty much free of pain.
he didn't take pain medication.
Didn't take any pain medication. All 3 doctors would come into my room nearly every day to make sure I was okay. And they would check me out in their own way. And I thought that was amazing, because in the States, I don't know that you'd ever get a doctor to come back. Once you finish the job, that's it. So that was great. The nurses were very attentive and quite professional. Those are the things that I noticed were quite good.
the cleanliness of the hospital. I mean, I had surgery for the first time in Turkey. You can't compare. No, we just loved him. He was, the first time we met with him, he spent an hour with us. That's unheard of. That's unheard of. He was doing stuff on the computer and he was asking questions, and I mean, that's unheard of for us, for a surgeon to spend an hour with us. But he came in the room all the time. He talked with us, looked us right in the eye. Yeah, we couldn't say enough about him. He was wonderful. So yeah, that was a great part of the whole experience. And we're not used to that. So it's Thailand, you know? Yeah. I hope Thai people understand what a valuable asset that is. And they're known worldwide for their medical. They know, I mean, every time we told anybody, Peter's going to Thailand for this surgery, they said, good choice.
If you have any concern about stroke or carotid artery disease, please don't hesitate to contact our team at Bangkok Heart Hospital. We are here to support you and your loved one.